Hello, I'm Dr. Mark Dailey. I want to thank you for taking a moment to watch this video. Today we're going to present part 5 of our low back injury prevention workshop. When and if you're ready, I'd love to come out and conduct the program for you in an effort to reduce workers' compensation claims and increase productivity. You're welcome to call our office at 205-467-2500 and discuss dates and times that would work for you. So, what do you do if you do injure your back? Maybe you injure your back at home. Now, of course, I recognize if you hurt yourself at work, number one, first and foremost, you follow the protocol which is set up by your company, and you simply do what you're told. Now, if you hurt yourself at home, let's say that you have a mild injury or mild back pain, what do? Do you use ice or do you use heat? Well, let me explain the inflammatory process. When you injure your back, you are most likely causing soft tissue injury. Inflammation is the result of tissue injury. So in a sense, the body is protecting and restricting movement in the injured area by surrounding it with fluid known as edema or inflammation. Inflammation is increased by dry heat, and I did say dry heat, literally pulled towards the heating pad, which is what many people use, and that will ultimately increase the stiffness and the pain. Although it does feel good for most folks at the time, it really is more of a distraction. On the other hand, if you put ice on the injured area, 20 minutes on and then take it off for 40 minutes and then you can reapply, the body will sense how cold the injured area is and will send that fresh blood. It will send fresh blood and it will push out a lot of the inflammation, which in turn will reduce soreness and stiffness and inflammation. So always use ice on an acute or recent injury. Also, Epsom salt baths. Keep in mind, Epsom salt baths, that's hot water, not dry heat, is a great idea. The magnesium in Epsom salt is like a muscle relaxer. It reduces soreness and inflammation. Also, you need to know that prolonged bed rest is the best way to produce severe disuse syndrome and muscle wasting. So that's not something we suggest. Studies show that 2 days of bed rest are better than 7. No bed rest was better than 4 days of bed rest. And people with no bed rest reported significantly less restriction of daily activities and returned to normal levels of activity faster than those that stayed in bed for at least 4 days. So if you have an injured back, if you hurt yourself, ice, 20 minutes on, 40 minutes off. Soak in hot Epsom salt baths and do your best to keep moving. Thank you and have a great day.